Hey, 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 welcome, welcome, welcome. You're tuned in to another episode of
Sistars in Medicine.
I'm Akila.
And I'm Samia.
And we are so glad that you're joining us today for episode 4. In our last episode, we talked about the historical implications of mistrust in the medical system and today, and we're going to dive into a more personal and more complex topic about underrepresentation in the medical field. For many people of color, medicine can feel like a place where you're underrepresented. In this episode, we'll be discussing the challenges and our unique experiences of being Black providers and why having more representation in healthcare is so critical, not just for us as providers, but for the patients we care for.
Absolutely. Yeah, so before we get started with what we're talking about today, I just wanted to do our routine, which is just checking in. It's our pulse check, just seeing how we're doing today. So, Akila, I wanted to start with you. How are you doing today?
I'm doing good. I'm just coming off a few shifts here and there that have just exhausted me, but I think overall I'm doing well. We're entering 2025, so I'm very happy and hopeful in regard to what we can bring to this space on the podcast, as well as growing as a provider outside of this space. So that's how I'm feeling today. How about you?
Yeah, I think that a new year is always a space where I like to reground myself. And I think that right now where I'm resting, when I'm sitting in, is that regrounding. I don't know what that looks like yet, but I do feel a sense of presence and trying to be a little bit calm. I was very, very exhausted at the end of last year. And so I'm just trying to redirect and rechannel my energy. I only have 6 more months left of residency, so I'm trying to use that as like my motivator and my energy booster.
Perfect. Yeah. So happy New Year to everyone who's listening, and here we go. I want to speak to my experience as a midwife and a women's health nurse practitioner. So as a Black provider, there are moments when it feels like you're breaking barriers, right? By just simply being in the room, being in the space.
Yes.
I've been in settings where I was the only person of color in the room. And that can be both empowering and isolating at the same time. Empowering because it allows me to bring in a new, unique perspective, right? That others don't have, which can feel like an opportunity to challenge the status quo and introduce different ways of thinking. And kind of like some of the topics that we touched on in the last episode when it was specifically relating to, I talked about maternal alpha-fetoprotein, right?
Yes.
I am a midwife of 1 year. I brought this topic up to a group of women spanning 20 years of midwifery or women's health experience and them not knowing this was an actual thing. So definitely honing in on introducing different ways of thinking, different aspects of healthcare that I am focused in on that others who are not of color would not normally have in conversations or even think about. And then there is isolation. Those moments of feeling like, oh, I have to bring this up again, or the lack of acknowledgement of a specific action that's happened, may it be between colleagues or with patients. Those moments, I feel like I am in my own little microcosm. I'm not able to necessarily verbalize the things all the time. And a lot of times when I do encounter that, I have to sit back and think about how I can effectively speak about certain things.
Yes.
I find that I have many teaching moments within my practice. I definitely encounter microaggressions that are present, and that is by my colleagues or even by the patients themselves. I literally had an OB not too long ago ask me how long I've been a provider. And this interaction was something of a collaborative space. I was talking to this particular individual in regard to my patient who I was caring for. Then this individual proceeded to tell me to always do the right thing. And I sat with that and thought, I'm literally collaborating with you in regard to how I should navigate treating a patient because your expertise is warranted within this space. And in the same breath, you sit there and tell me to do the right thing. It's kind of like those slights, those little microaggressions. And I thought to myself, lady, I am doing the right thing by sitting here and having a conversation about something that's happening to my patient. So little things like that. And this same individual also sat there and told me to not trust everything patients say. So not only am I sitting with you in regard to telling me that I should do the right thing, whatever that means for that particular individual, and then coming back and telling me not to trust what patients say, which is the complete opposite of how I move and how I navigate and how I provide care to patients. So yeah, it's definitely a space of isolation and definitely a place of empowerment.
That makes sense. I think that for me, even with my own experience as both a medical student and now as a resident, I think the thing that you mentioned around how you're in a meeting with your colleagues and having the need to bring up alpha fetoprotein for people who've been in practice for 20 plus years and them not having this idea always is that the people they do not care about things that don't impact them.
Right.
So I'm not going to give people credit by saying you don't know what you don't know. No, you do not care about the things that don't impact you.
Right.
And oftentimes I am forced into leadership roles just because, I guess, of my personality. But I think that I end up always inheriting some type of role where I have to interface with administration or faculty or the folks who are teaching and training us. And I'm often in the room as the solo Black person in the room, similar to you. And I am the trainee in often of these dynamics and in these spaces. So definitely just kind of absorbing and appreciating the power dynamic that exists there because I'm the person who's the trainee, but often finding the need to emphasize a perspective that none of these other folks hold in this space that actually has implications and repercussions both for patients and also just as folks who are learners and trainees.
Definitely.
That people really, they don't think through the ramifications of some of their actions because it's never had to impact them.
Definitely.
One of the ways that this shows up is that people always want to recruit diverse trainees, right? You're always hearing this. As you mentioned before, it is a trigger point for you that there's always this emphasis on bringing folks, let's bring people into the table. We want to have more diverse workspaces, which are not the solutions to things. Like bringing people in isn't the solution, right? Because you're bringing folks into a system that they were never meant to be a part of. So you have to actually readjust and change your workspace, your dynamic, in order to truly have this person be impactful. Just having your minority hire doesn't mean that your area is diverse, right? Not at all. One of the questions that I pose in two leadership positions, both when I was in med school and also now as a resident, I have said that your institution wants to recruit what they always say in medicine, underrepresented minorities in medicine, URM. That's the sort of buzzword that they say. Yeah. They always want to recruit URM students or residents. But so recruitment. But the other arm of recruitment is retention.
Right.
So how is it that you are recruiting folks and at the same time, how are you supporting these individuals?
Right.
And people who are URMs have various backgrounds and experiences. Not everyone has been impoverished, for example. Some people come from a lineage of doctors, pharmacists, X, Y, and Z in the families.
We're not a monolith.
We are not. Not at all. But most folks who are underrepresented minorities in medicine do have experiences that have not had access to all of the resources that their peers, their counterpoints have arrived at to bring them to this position. That is facts. That is majority of folks. That's not everyone, but that is the majority. So how then are you going to ensure that these folks are supported, are protected, are heard, and feel safe in a learning environment that has historically been hostile to these individuals?
Right.
Every single time I pose this question, literally blank faces. They're just like, what do you mean?
Never heard of it.
What do you mean? What do you mean? What do I mean? Like, if you're someone who's in the business of recruiting, then you know that retention is the other arm of that. Right. All workspaces have retention like programs. That's why they give like bonuses, or they give free gifts, or they do all these things. But when it comes to education, everyone always has blinders on this piece. Let's just bring all these people here. Let's bring all these people here. But how is your system going to change in order to support folks?
Right.
That is literally been the thing that I'm constantly pushing against for people to do. Also, I highlight for them that I'm not going to do that work because you're not paying me extra to do it. And that, in fact, there are people who have master's degrees in higher ed that actually do this work of creating your spaces to be more truly inclusive to the people that you're trying to recruit.
Right.
Mm-hmm.
Yes. I want to go back and speak to something in the same regard and accord that you just spoke on in terms of recruitment. Mm-hmm. Going back to how I am the only midwife of color on staff currently at my clinic that I work for. And the number one thing that I always talk about is recruitment. Mm-hmm. And these individuals have no idea how to recruit people of color. Mm-hmm. And the first thing that they say out of their mouths is, "Do you know anyone?" Which, one part of it, I'm like, okay, that's nice that you're actually, you want my opinion on who should be in this practice, who you should probably interview for this practice that is someone of color. But at the same time, like you said, that's not my job. That's not my position. Like, you should know how to actively recruit anyone. Mm-hmm. And to actively recruit someone of color, there are steps and there are processes that you should be able to implement to do so. Do you have any connections with the universities within the area? Are you actually actively in the community? Are you talking with specific birth workers within the community to get an idea of who's maybe interested in being in this space, or who you're actually interested in bringing into this space? It's very interesting that recruitment is being asked by me. It's very mind-boggling. Yes. And to have an institution, or there's various institutions that say, like you said, that their bottom line is they want to have a more diverse working environment. And you would think, if that is the goal, that they would have certain systems in place to implement such requirements. I totally hear you and understand that aspect.
And also, if that is their bottom line, that they would be doing the work of getting the person who does this for a living,
right,
to be able to help them with that process, right? There would be that sort of fundamental understanding that this isn't just something that happens overnight, that there has to be true change and deep unheveling of some of our standard practices in order to really make this a reality.
For sure.
And you talked about microaggressions. I call them macroaggressions because, for example, I am one of 2 Black female residents in my cohort of 6. She and I are always confused. We both have names that start with the letter S, and that's about as similar as she and I are. I am 5'10". She is not. She's a good maybe. I don't even want to underestimate her height, but I think she's about like 5'5", maybe. Mm-hmm. And we're very different people. We look different, and I mean, the height is enough for anyone to sort of acknowledge that we are 2 different people. But folks always misname us. Okay, they always confuse us. That happens all the time. And that's, again, I think that's a macroaggression as opposed to a micro one. And then often there are always comments, always about Black women's hair. No matter where you are, there's always this conversation that has to talk about your hair in some regard. And I'm like, leave me alone. So that often does come up too when we are in our medical training settings. And of course, there is the the macroaggressions that you experience even with patient interactions. As for myself, as being a Black family doctor in training, I have often gone into rooms when people are just looking at me like, who are you? Why are you in here? I'm expecting a different body to be presented in front of me as your doctor. So those things do happen both in inpatient settings, so when I'm in the hospital, and also when I'm just having my own clinic as well.
Definitely, definitely. And then when we are specifically speaking to representation within our own respective specialties, it's super important to have representation in general. And the importance of that is having patients see themselves within their providers. And when we say this, it's kind of like a reiteration of something that we talked about in the historical implications of mistrust within the medical system is, having someone that looks like you within that space. And the reason why it's important is being able to have a commonality to a certain extent. Like I said before, we're not a monolith, but having a commonality in the sense of understanding the certain things such as barriers that individuals experience as Black patients, as individuals experience as marginalized individuals. When you have that same lived experience or an understanding of that lived experience, that's what's really important and one of the driving forces in regard to be able to provide care to patients that trust you. Just speaking to my own experience, again, in the midwifery space, in the women's health space, when I have encountered individuals that are Black individuals or even people of color come into that space. And like you said before, you've had that experience when you see the light in their eyes. They're so relieved that you exist that they're able to kind of like relinquish this kind of fear of having to be in the space, experiencing any medical intervention or diagnoses because they have someone there that, looks like them. And that could be the smallest thing in the women's health range is a pap smear or, having a discussion about sexually transmitted infections and not feeling that they're judged. These are all very super important aspects of individuals that are seeing someone that looks like them.
Absolutely. And it's not just our anecdote, right? Studies have shown that having diverse healthcare providers can improve health outcomes for minority populations. It's not just about representation in terms of race, but in understanding cultural nuances, listening to patients' concerns, and building that trust. When a patient feels seen and understood, 30% are more likely to follow through with treatments. That's 30%. And they're also more likely to attend appointments and feel empowered in their health journey. It's important to remember that as Black providers, we aren't just doctors or midwives. We're also role models. But it's a double-edged sword sometimes, right? The pressure to represent can be overwhelming, especially when you're one of few, like you and I are, or the only one. But we also carry the responsibility of showing younger generations that they too can aspire to be in these spaces. So that being said, right, I just wanted to take a moment to see, like, how do you hold and process that piece of that double-edged sort of duality? Because if we're thinking about how we have to hold being in spaces, as we talked about, of our own experiences that can be both micro and macro aggressions, but then also feeling very much like a role model responsibility to take care of folks, especially Black patients in our spaces. How do you hold that? How do you process that?
And I'm going to add to that as I answer how we're processing it. So not only experiencing micro and macro aggressions as providers, but also being patients ourselves and experiencing some of the issues in terms of discrimination within healthcare or just in general, and how we're in these spaces and feel that we got the wrong diagnoses or the wrong information. I can tell you that I have been a patient in a space where I was told some information prior to even having like the medical background, some information that I feel affected me for 5, 6, 7+ years because this person gave me the wrong information, and it was because I was a Black woman. And so having that experience, and also being a provider and knowing that can happen to individuals, and having those spaces of microaggressions and macroaggressions, and now navigating like, how can I show up for this particular patient, is I check myself every single day before I go into my practice. I always kind of reiterate why I'm there, and what I can expect from myself is to show up as best as I can in the space of being a provider. I have no judgment. That's not my place. I'm there to provide efficient and effective care to my patients. So I kind of do like a self-check-in every day, and that's how I show up, regardless of what's going on around me, regardless of what I've experienced. But knowing these things in the back of my head, that some patient may show up and feel exactly how I did as a patient. So that's kind of what I do with this, duality of existence. What about you?
I think that I posed this question because it was a question that my therapist actually asked me.
Okay.
As I was sort of sharing with her just different experiences. And she just said, well, how do you process and hold all of these pieces? And I think that for me, I really sit in the moment. I really sit in the moment. And I'm very comfortable with saying, I don't know, or I'm going to research that and I'm going to find that out for you.
For sure.
And I think that allowing myself to sit in the moment also allows me to process the weight of everything that we're talking about.
Right.
Our own experiences of healthcare trauma, as well as being in a system and being the face of a system that may be propagating trauma on the patient that we're interacting with.
Right.
It really is just taking it one day at a time, giving myself the space to yell, scream, be angry, work it out, cry if need be, if that's how I'm actually really sitting with and processing all of the different pieces that we have to hold, but reminding ourselves for why it is that we show up for our patients in the way that we do is really how I sit through and process. Of course, I have a therapist, so that helps too.
And I advocate that for myself. I'm working on it. I'm getting to that space. But definitely having the space where me and you can have these types of conversations. My family is there for support in terms of, expressing certain concerns with the way the healthcare system is and how I'm trying to navigate and show up the best way that I can, is definitely a great resource. But I'm going to be like you soon, looking up to the little sister and advocating for a therapist to help navigate, life within itself, but also being a provider in a system that is, that needs a lot of work. That needs a lot of work.
Yes.
So like I said, representation is so important in healthcare because patients need to see themselves reflected in the providers. There's this immediate trust that gets built, and for many of our patients, that can make a huge difference in the quality of care they receive. And now I want to talk to you the broader importance of diversity in medicine. We need more Black providers, as we've, stated and reiterate, and will continue to reiterate, in all areas of medicine, not just doctors, but nurses, therapists, medical researchers, and administrators. The diversity of thought, experience, and culture is so important. Medicine is a global field, and without diverse perspectives, we risk losing the full picture of what healing looks like for all people. I've seen anecdotally in the recent years an increase in diversity in medicine, but it's slow.
Yes.
We need a systemic shift in how we recruit, like we mentioned, and to retain, like you mentioned, Black and other minority healthcare professionals. One of the most powerful things we can do as Black providers is mentor the next generation. We've both been mentored by others, and now we try to do the same for within our community. I've always been open to, being a preceptor for individuals, or like we talked about, being mentors. I've mentored a few young individuals in regard to helping them reach their potential or in aspirations and being in the field of medicine. I think is super important on both of our ends. It's not just about providing guidance. It's about showing them that this space is where they belong. For me, being in medicine has become about more than just patient care. It's more about advocacy. I've learned that my role isn't just to treat illness, but to advocate for systemic change within the field, specifically within maternal health care and women's health. From ensuring diverse representation in healthcare leadership to pushing for equity in medical education. We can't just sit back and wait for the change to happen. We need to make it happen within our own communities, and that's the way that we can do it through mentorship and education.
Absolutely. And I humbly say that in the beginning of my higher education journey, I was very hesitant to explore mentorship, becoming a mentee, because truthfully speaking, I didn't really know what that meant.
Right.
I think that I naturally had some relationships with older adults in my undergraduate career who ended up becoming and fitting the roles of mentors, but that happened very organically, very naturally. So I didn't really consider them mentors until I realized that these folks had been guiding lights on my journey to finishing my undergraduate career and what my next steps would be like. So I think that initially in thinking about higher education, I was like, I don't need no mentor. What is that? I don't know what that means. But then as I started to realize that so much of my time had been so focused on just trying to arrive to med school that when I got there, I wasn't really sure what to do. And that also was the case for a couple of my Black peers, especially folks who didn't have family members in medicine, that we fought so hard just to get here. We didn't really know what to do in this space when we got there. And that's when I started to go to some of the events that were held by my school just to check in with people who had already graduated from the program. Again, they were all events that were focused on underrepresented minorities in medicine. And then that's when I started to talk to folks. I applied to internship programs, and that's where I met folks who doctors and the Black doctors in the field who are my mentors to this day. And so I think that mentorship looks different for every individual person, and it does not have to be a very cookie cutter thing, but it's just about showing up and arriving for people who are navigating a journey and they look like the only person there, and just being able to provide some words of encouragement, some things to avoid, and what pitfalls can happen on the way, just as a part of the journey. I think that for me, I've had to be comfortable with identifying myself as a mentor, because I'm like, I'm chaos. I'm like, don't do this. This is crazy. This is insane. But at the same time, I understand and really truly value the importance of having other Black practitioners in the field of medicine, because it's so, so important in thinking about patient care. Because like I said before, people do not pay attention to things that do not impact them. And when there are no Black people in a space, they are not thinking about the things that impact Black people on a day-to-day basis, which actually has more of an impact on their health than them not actually showing up to appointments. So day-to-day stressors really is what impacts some of the health, and dealing with and holding anti-Black racism on a day-to-day basis. How that physically manifests in the body is very different for every Black person. And so people don't think about those things. Some allies who identify themselves as allies will try, but that's not a full understanding of the picture, and very much being able to say, I don't necessarily know what it's like to be hungry every day, but you're sitting here in my office and I understand the things that set you up so that you are hungry every day is huge for patient care and patient outcomes.
Definitely. Understanding and acknowledging the barriers. That's number one. And I also want to speak back to what you're talking about being a mentee versus a mentor. And through my journey as a midwife, or just in nursing in general, I never necessarily felt that I had a mentor. I definitely am someone of the cloth that is like, here's a goal, I'm going to meet it, and that's all I need to know. Like, I don't need any help. I don't need any guidance on any of these things, because I know I'm going to get it done, and I'm going to get it done in this way. But I did notice that I always for whatever reason, took on the role of a mentor for individuals, always educating, always guiding. Even so, within nursing school, I found myself doing that with my classmates. So I definitely feel empowered in that space of mentoring people. And I think eventually that will grow as I continue to learn in my respective specialty. But as I got to grad school, I definitely found that I had a mentor in one of my colleagues that I used to work with. Her name is Shelly. Hi, Shelly. She was so inspirational to me. Just a lot of her background that she talked to me about, her experiences, and just how she navigated her education. She was an inspiration to me at this particular point in my life. And just our short conversations that we had, she would send me articles about different things, and she really helped guide me in the last few, years of my education as a midwife. And I really appreciate that. And it was the first time that I felt that I was being mentored. I was in the mentee seat. And I definitely think that everyone deserves to have a mentor that looks like them, that understands their struggle, who have the same type of goals in the sense of helping provide better, effective, and efficient care to patients. So I just kind of wanted to circle back and talk about that.
Absolutely.
So reflecting on our roles and moving forward, despite the challenges, it's what keeps us going, right? Is to acknowledge that we're making a difference in our own way, in our own little capacity, in our own microcosm. But it's not always easy. But every time I see a patient and I realize I'm someone that they can relate to, I know that representation truly matters. That's what fuels me. I'm committed to pushing the boundaries and creating spaces for others to follow in my footsteps and our footsteps. And that could be individuals who aren't related to us versus individuals who are listening out there in the audience to, within our own families, within our siblings, if they, want to change the trajectory of their careers, so be it. Or our cousins, or I just had a cousin who is very much interested in doula care. And so I have an aunt who's, been asking me questions about it, and I've been giving them, the answers. So having that community in regard to help guide people in specific directions in terms of healthcare is very, I think, empowering for us within our own families. And then we have nieces and nephews who look up to us in regard to this particular field, and they have questions and they have aspirations. So I think that kind of fulfills me as well.
I would say that that's such a good question about like what keeps me going. In particular, I'll use I statements about what keeps me going, because I will say truthfully that I have considered quitting seriously maybe 10 plus times on this journey. Because residency is, as I've mentioned before in earlier episodes, residency is hell. Like it is what feels like a full giving and a full sacrifice that sometimes doesn't always align with what I might want to be doing in my life right now. And so it can be very, very frustrating. It's also that I don't have full control over my schedule or where I'm supposed to go or what things are supposed to be. So that part of it can be challenging. It can be difficult. But I think that what keeps me going is, one, knowing that it's not always going to be this way, that I have a vision of what I would like to see as care, as practice in the future that isn't this. And that actually excites me, because being able to be creative about the possibility of what care delivery could look like from my own mind and not necessarily from the systems that already exist is something that is perplexing, it's challenging, but it's also exciting to think about ways to really truly meet people where they are. I've mentioned before that I think about medicine more as healing, and like really, really, truly getting back to this art of healing that is like removed from the systems that currently exist, and being able to think about working with communities and having folks all be trained on CPR you know, every single person. So when you go into any kind of mile radius, everybody knows how to do CPR from the age of 8 and up, so that if something happens, they can respond. Also call 911 and have improved health outcomes because everyone in this certain area knows how to do CPR. So just kind of like, that's just a little thing, but just like giving power back to the communities around their health is something that is really important to me. And for thinking about the utility of osteopathy and sort of healing touch to be able to really ground into a person's body and to feel what their experience is and hopefully aid in some of the relief of some of that discomfort those are the things that really motivate and get me up and keep continuing to do this work even despite how challenging it can be sometimes.
Definitely more of an investment into the future, an investment in the future.
Yes.
Yes.
So if you're listening to this and you're considering a career in medicine, know that we do need you. I know I like to talk my stuff, but I do think that it is important and that you are very much needed in the space of healthcare. Your presence in the field is essential, and we need more people who understand that representation is more than just a number. It's about making patients feel heard and seen and changing the narrative for future generations and changing a workspace and making it more inviting and warm and truly inclusive for the people who have to continually show up and work in them.
Yes. And as we wrap up, I want to emphasize that being a Black provider is more than just a role. It's a responsibility and a privilege. I want to reiterate that throughout every episode, that I am highly, highly, highly grateful to be in this space that I'm in women's health. And to help provide care to my patients, specifically my BIPOC patients, but all of my patients. It's about breaking barriers, challenging the status quo, and most importantly, ensuring that our patients feel understood. We'll always keep harping on that, having our patients being seen and understood. Our stories, our experiences, and our voices are all part of what makes healthcare richer and more human.
In our next episode, we'll be talking about systemic racism in healthcare and the implications for Black communities and beyond. As always, I'm Samia.
And I'm Akila. And thank you for tuning into
Sistars in Medicine.
Stay curious.
And be well.
And we'll catch you next time.
Bye.
Bye.